Bharat Pankhania, who joins me live from Edinburgh in Scotland. He's a senior clinical lecturer at the University of Exeter Medical School. Appreciate you taking the time. I'm curious as to your professional opinion, first of all. Do you think that people should be going and re-upping on their vaccinations?
Yes, good afternoon. The important bit is we know the at-risk groups, and my advice to the at-risk groups, especially people aged over 65 or people with other health conditions like diabetes or immune suppression, to make sure that they are immunized. So we also know that the vaccines are preventing people mostly from getting seriously ill and dying. So really, the big strategy is when offered the vaccines, please do get vaccinated. And if you haven't really had your vaccine yet, please do so as soon as possible.
Do these vaccines wear off? A lot of people will have had the vaccine. Maybe I've been in this situation myself, had a couple of doses, caught COVID. It wasn't pleasant. It was worse than the effect I got from the vaccination. Now, a lot of people might think, I don't need to do any more now. My body's kind of adjusted and knows how to deal with this virus. Does it work like that or not?
No, it doesn't work like that. Let me explain. So with respect to coronavirus immunity, unfortunately, whether it is immunity derived from a recent infection or a vaccine, unfortunately, that immune memory is not long lasting. And this is the reason why we say in especially the at-risk groups that we continuously, regularly, immunize to remind your body that coronavirus looks like this and have some immune responses ready when you encounter the virus. So unlike, say, the MMR vaccine, whereby 2 vaccines will give you lifelong immunity, unfortunately, with the coronavirus, the immunity is not long lasting.
There will be plenty of people at home, because I've seen their comments on social media. They see people they know, young people, die. There's no obvious explanation. They immediately say that could have been the vaccines. Has there been any research done at this point to try and uncover whether there might be health repercussions from taking the vaccines, or is it just still too early to say?
No, we've already got a pretty good body of evidence, and that evidence gathering and analysis still continues. It's a continuous process. I can say it with clear honesty and my knowledge, which is vaccines protect lives. Vaccines are not harmful. Vaccines in some people, in a very minority of cases, have produced adverse side effects, and including deaths. However, with more than 1 billion doses of the vaccines given, we are pretty confident that the vaccines do what they do, and they do it very well.
Doctor, great to get your take on this. Dr. Bharat Pankhania, my guest. He's a senior clinical lecturer at the University of Exeter Medical School.